I've been obsessed with Severance, the show, and rightly so. It is brilliant. And that's probably a good sign, being obsessed with something. I haven't been obsessed with anything in a long time, or even taken any pleasure in anything really. The show has a lot to obsess about because it is so much more than the mystery, so much philosophy about identity, stuff I've already spent a lot of time thinking about in my life. In fact, my next episode was going to be about free will, but I decided I needed to talk about last night's episode instead. Not really last night's episode, my experience relating to it. So, sometime last season, I realized that I have personally experienced something like the severance procedure in a medical setting. And the episode I saw last night, and this is going to be a very mild spoiler for season 2, episode 7, but I promise I won't get into details. So the episode I saw last night actually went there, touched on my specific experience. I was severed for surgery. You may have been too. It's more common than one might think. This is my experience. When I was a teenager, I needed to have my upper wisdom teeth out. One was impacted and sideways, fused to the bone. My brother-in-law was a dentist, and his practice as oral surgeon would perform the procedure. They said they were supposed to give me sodium pentothal, but for some reason they weren't using it anymore, so they would just give me Novocaine. I explained how difficult, if not impossible, it was to make me numb, and I was not going to go through the procedure without sedation. So he said there was something else. He said there was another sedative, Versed, that we could try, and me not knowing anything, agreed. When my memories started again, after the procedure, I was in the chair, shaking and crying. My lips, my mouth was cut up and bleeding. I didn't feel like I just woke up after surgery. I felt like I lost time and that something terrible happened. Also, I was not numb at all. My friend who drove me carried me out of the room. Over the next couple of days, they gave me Percocet for the pain, but it didn't work and I threw up a lot. I kept taking it because I thought I was throwing up because I was in so much pain, but I didn't realize it was just the medicine making me throw up, so that was pretty miserable too. A day or so later, my sister filled me in on what happened. When the procedure started, I started screaming. Let me reiterate, in case it wasn't clear, this was not just getting a tooth pulled. They had to cut into my gums and break the tooth away from the jawbone that it was fused sideways to. The oral surgeon told my brother-in-law that I was just having a bad reaction to the drug and that they should proceed. He had seen this once before, my brother-in-law, and he believed the surgeon. He believed it was just a bad reaction. So they held me down, they clamped open my jaw, and they just did the surgery while I screamed. At this point, my sister telling me the story, I just accepted what she said, that I was just having a bad reaction to the drug. So sometime later, after not being able to complete a root canal while conscious, to be fair, it wasn't just the trauma. The dentist I went to for this was another sadist. That's a whole nother story. So after I couldn't do the root canal, I ended up having to go to the hospital for the root canal to get it under general anesthesia. So I was in the hospital room filling out the paperwork with the nurse before, and where they ask if you have any issues with drugs, I wrote Versed. The nurse asked me to elaborate, so I told her what I thought I knew, that I had a bad reaction to it. And then she explained to me what Versed is and deduced what really happened. that I was awake and not numb, and that the drug just made me forget I was conscious during the procedure. Coincidentally, there was a new show talking about waking up during surgery on the TV in the background while this was happening. Not exactly what I went through, but, still. So, midazolam, brand name Versed, is used to make you forget if you wake up during surgery. It can have sedative properties, but it is primarily an amnesiac. Used alone, it causes you to not form new memories, with a little retrograde amnesia as well. It is commonly used in dentistry, though my experience may have been extreme compared to what normally happens. I've heard medical professionals talk about it for dentistry and for colonoscopies, but probably not limited to that. That, it is okay to go a little harder on the patient because they're not going to remember it. If anything, it should be used along with a cocktail of other drugs, like it's usually used in general anesthesia. But when it's used alone, it is basically Severance. I have a close friend who used to be a dental assistant who told me this practice was regularly done to small children whose gums were supposedly too small to numb. They would bind them in like a papoose and they would cry and scream and then forget, and their parents would consent to this. I think the idea is to not have traumatic experiences prevent them from going to the dentist in the future. I read a medical paper on this once. It has also been abandoned as a drug used in executions in some states for being inhumane. So for years, I couldn't even sit in a dentist chair without having a panic attack. I couldn't have a dentist touch me, even in a non-invasive way. It isn't even about fear of pain. It is about the loss of control. I pulled out a partial tooth by myself with some Ambisol and a pair of tweezers to avoid going to the dentist. I did a dry socket procedure on myself at the dentist office while a dental assistant held up a mirror and walked me through it. This practice relies on its very nature, the patient not remembering anything. I was in a rare situation where I found out exactly what happened. Is my PTSD due to the fact that I know about it, or just that it happened at all and it is buried somewhere? If a medical professional ever says that they are going to give you something to relax and they don't tell you what it is, find out what it is. I would also be wary of propofol, which is used as an amnesiac, though to a lesser extent, though there have been studies to show that people on propofol alone are conscious and can experience pain but forget after. My niece had major surgery under propofol. I expressed my concerns. She said it doesn't matter if she doesn't remember it. It isn't entirely unsurprising that doctors think amnesia is the same as anesthesia and even possibly a replacement for analgesia. Hippocratic oath aside, I guess. But I am really surprised how many patients think the same thing. What do you think? Would you go into surgery knowing that you were about to get tortured, but then you're going to forget about it? Or would you demand real anesthesia? I'm really curious how people feel about this. I'm surprised how many people think it's okay when they hear about it for the first time. Please let me know.